You're 22 years old and you've never seen a real brain. You watched one on a screen in a lecture hall that smelled like antiseptic and old coffee, grainy footage of a craniotomy filmed sometime in the 90s. The professor paused on an aneurysm clip and said this: if you clamp the wrong vessel, the patient dies before you close. Nobody laughed. You wrote it down in a notebook that you still have, tucked in a drawer somewhere, the page corners bent from being flipped to too fast. First year, you don't touch a patient. You memorize 206 bones, 12 cranial nerves, the circle of Willis. You learn that the brainstem controls everything your body does without asking permission. You take an exam on neuroanatomy and score in the top 10%. You feel like a genius. You feel like an imposter pretending to be a genius. Both feelings are accurate. You walk past the operating rooms on your hospital tour. The doors swing open for a second and you see a head clamped in place, a rectangle of skull sitting on a metal tray, and a pair of gloved hands working inside something that looks like pink jello. The doors close. You stand there for a moment. You don't know what you expected, but it wasn't how ordinary it looks. Like the most extraordinary thing in the world is just another Tuesday for the people in that room. You want to be one of them. You don't know yet what that will cost. Match day. You open an email that tells you where you'll spend the next 7 years of your life. Cleveland. You've never been to Cleveland. You pack 4 bags and drive 12 hours in a car that smells like fast food and anxiety. Your first week, a patient codes on the floor. The senior resident runs past you and you stand against the wall, holding a chart you don't need, watching a team push drugs and shock a heart back into rhythm. The patient survives. You did nothing. You were furniture. That's the correct role for a first week. But something in you makes a note. Next time, you won't be furniture. Year 2, you hold a retractor for the first time. 6 hours of standing perfectly still while an attending dissects a meningioma off the optic nerve. Your back screams. Your hands don't move. At the end, the attending says, "Good job," without looking at you, and you carry that sentence around for a week like it's made of gold. Year 4, your first solo closure. The attending lets you drill the final burr hole and close the dura. Your hands are steady. You don't realize until later that they weren't shaking because you weren't thinking about shaking. You were thinking about the patient. That's the moment you understand the difference between a student and a surgeon. A student worries about performing. A surgeon worries about the person on the table. You're not a student anymore. Fellowship. You chose skull-base surgery, the corner of neurosurgery where a 1 mm mistake means your patient never speaks again. Your fellowship director has been doing this for 28 years. He doesn't raise his voice. He doesn't repeat himself. He once operated for 14 hours straight without sitting down, without eating, without drinking anything except a single cup of coffee at hour 6. You watch him remove a tumor from the clivus, a location so deep in the skull that most surgeons never go there. The approach takes 2 hours just to reach the pathology. The resection takes 3 more. The room is silent except for the suction and the bipolar forceps and his instructions, which come in 3-word sentences with no emotional weight. More exposure. Suction here. Stop. You study his hands the way a musician studies a masterclass recording. Frame by frame. Looking for the thing you're missing. You learn that experience isn't knowing what to do. It's knowing what not to do. The surgeons who get in trouble aren't the ones who do too little. They're the ones who do too much. You learn to do less. That's the year you become a real surgeon. You have your own patients now. This part they don't train you for. When a family sits across from you and asks what happens next, the answer is yours. There's no attending above you to look at. The family is looking at you. You lose your first patient 3 months in. 71 years old, glioblastoma multiforme, the worst brain cancer there is. The surgery was clean. Perfect margins. No complications. And 3 months later, she was gone anyway. The cancer didn't care about clean margins. You sit with the family in a small room with bad lighting and a box of tissues on the table that nobody is using. You say the words you practiced in the mirror during residency. They feel like nothing. The daughter asks if you did everything you could. You say yes. It's the truth. It doesn't make the truth easier to deliver. You go home at midnight. You sit in your car in the driveway for 20 minutes. You go inside and your partner asks how your day was. You say, fine. You don't sleep well. You go back the next morning because there's another patient on the schedule. That's the job. It never pauses for you to feel anything. Years pass. You become the person that other surgeons call when their cases go wrong. You operate on the tumors that nobody else will touch. You're sent the patients who've been told there's nothing else that can be done. Some of them, you help. Some of them, you can't. You learn to live with both outcomes. You run the department now. Budget meetings, hiring decisions, credentialing battles with hospital administration. You sit across from a resident who's struggling and you have a conversation that reminds you of the one your attending had with you, 15 years ago, about the medication error. You don't raise your voice. You explain what could happen. You watch them decide whether to stay or leave. They stay. Most of them do. You've trained 19 residents who are now attendings at their own hospitals. Some of them are better than you were at their age. That was always the goal. You see your name in a textbook once, cited in a paper on surgical approaches to the cavernous sinus. You close the book and don't tell anyone. It feels strange to be permanent on paper when you still feel temporary in your own life. Your last surgery is on a Tuesday. You know it's the last one. You don't tell anyone. You don't want the room to feel different. The case is routine. Pituitary adenoma. An hour and 40 minutes. Clean approach. Clean resection. Clean closure. You step back from the table and pull off your gloves. The scrub nurse, who's worked with you for 16 years, looks at you from across the room. She knows. You nod once. You change out of your scrubs and walk to the parking lot. You sit in your car without starting it. You think about the 22-year-old who didn't know what a real brain looked like. You think about the first time you held a retractor. You think about the 71-year-old whose family you sat with, and the words that still feel like nothing, even after all these years. You start the car. You drive home. Tomorrow, you don't go back to the hospital. For 34 years, you showed up. The brain is the most complex structure in the known universe, and for 34 years, you were the person who tried to fix it when it broke. That's not nothing. That's everything. The attending who trained you once said that half of what you learn will be wrong in 10 years, and nobody knows which half. But you figured out the other half. The half that matters. The half that's about showing up. And you did. For 34 years, you showed up.